Thank you for that beautiful piece. Good morning, everyone. Happy Sabbath. My name is Dr.Ann Mutsach. I'm a medical doctor, currently dedicated to the service of cancer in Fangesile Mshale Cancer Center in Kitui. I have been tasked today with talking about cancer prevention, and I hope the information I have will help empower you and your families. Tomorrow we'll be celebrating the World Cancer Day, and the theme for this year will be closing the cancer gap, that we want to make sure that everyone has access to quality health care, regardless of who they are and where they are in life, even geographically. We hope to improve access to hospital care, affordable health care, and providing education to help people understand how to self-care. And that's why we are having the talk today. The topic is huge, but I just have 10 minutes, so I'm just going to rush through it. The outline of my talk is a definition of cancer, cancer logistics, the risk factors, and once we understand the risk factors, then we are able to understand what we can do to prevent the cancer. So it's important also to just find out what is cancer. Cancer is a process where we have an abnormal, purposeless, uncontrolled growth. This growth sometimes leads to formation of swellings in the body that maybe somebody can be able to touch. One way of explaining cancer is caused by very many factors. There is no one factor that causes it. It's just a combination of the different factors. And one way to explain it is using a vehicle, that the brake in a cell are maybe immune system and genes that are able to stop uncontrolled growth. And the accelerator would be maybe errors that are occurring in the genes, or maybe exposure to some carcinogens like tobacco, asbestos, radiation, chronic inflammation that create a conducive environment for the cancer cells to thrive. If we look at the data that we have on cancer, what is projecting is Globocan 2020, but last night we had a new update, the 2022 data, whereby the new cases have increased from 42,000 to around 45,000 in terms of incidence. And the mortality rate has also increased from 27,000 to 29,000. Breast cancer still remains number one at 16.2%. Cervical cancer number two at 13.1% in incidence. Prostate cancer is number 3 at 8%. Esophageal cancer at 7.5 becomes number 4. And colorectal cancer becomes number 5. And those are the cancers we normally screen for. Looking at the risk factors for cancer, we have risk factors that we can change and risk factors that we cannot change. So the ones that we cannot do anything about is like aging. You cannot do anything about growing old. There are cancers whereby as you grow older, your risk becomes higher. Genetics. Genes generally control cell growth and division. And if there is an error in this, then we can have cancer. We cannot control this. Gender and hormones, we have some certain cancers that are common in certain genders. For example, breast, which would be common in women. Men would be 1%. Prostate cancer would be common in men. And these ones are usually hormonally driven. A lot of estrogen leads to breast cancer. Then we have the factors that we can modify. And this is what we want to talk about when you're talking about prevention. So we have the use of tobacco, smoking, alcohol, living a sedentary lifestyle, and being obese, having an unhealthy diet, exposure to ultraviolet radiation or any other type of radiation, infections like the HPV virus infection that can cause cervical cancer, HBV, the hepatitis viruses that can cause liver cancer, the H. pylori bacteria that can cause stomach cancer, and we have parasites that can cause bladder cancer. Environmental, here we look at like also occupational exposures, like being exposed to asbestos, air pollution, ionizing radiation, and being exposed to some of the pesticides. When we look at chronic inflammation and the weak immune system, this is what is currently driving the new treatments for cancer in the world. Chronic inflammation, basically inflammation is a natural process that occurs in the body when we have an injury. But if the process stays for longer than it should, then it can cause a conducive environment for cancer cells to thrive. Then we can look a bit in detail about the immune system, because it's very important. What would weaken the immune system? Having an unhealthy weight, having an unhealthy diet, excessive alcohol and smoking, not taking adequate water, being hesitant to take vaccination for diseases that we can prevent, having poor health-seeking behaviors. You wait until you're very sick before you go to the doctor. Having poor hygiene practices, like the H. pylori bacteria, is a bacteria that can be caused by poor hygiene practices and can lead to cancer of the stomach. Studies have also shown that isolation and loneliness are risk factors for having a poor immune system, having poor stress management techniques, and having inadequate sleep and lack of exercise. So you can look at some of the preventive measures that we can do. We said the modifiable, we are able to do something about. So for example, quitting smoking and avoiding the intake of alcohol, being timely in taking your vaccinations, having a diet that is plant-based and rich in fruits and vegetables, and healthy fat. Healthy fat is fat from fish, fat from nuts. Maintaining a healthy weight, timely treatment of infections, for example, the H. pylori infection that can occur in the stomach, being physically active, and protecting yourself from ultraviolet rays, which could lead to skin cancer, by using sunscreen or wearing a big hat when you're going out and it is hot, or using an umbrella, and avoiding those very, very hot times of the day. You avoid being outside. Other measures that can help boost the immune system is like taking adequate water. The minimum amount of water an adult should take would be 2 liters, but depending on what activities you're involved in, this could exceed that. But the minimum should be 2 liters in a day. You need to maintain a healthy social network, have good stress management skills. This could be meditation, biking, hiking, going for maybe some social events, sharing with your friends, your neighbors, your fellow parishioners. Having adequate sleep, at least 7 to 8 hours in a day, and being mindful of the doctor visits, having regular screening. So I'm coming to the end of my presentation, and one thing I would like you to take from this is that cancer is not a death sentence. We had a British journalist, broadcaster and writer, who in the early 2000s passed away from cancer of the tongue, and he coined this phrase that cancer is a word and not a sentence. And he played a very vital role in cancer awareness. He showed us the importance of educating the public about cancer and its challenges. And he was talking from the point of view of a patient, so it had a lot of impact. So as we celebrate tomorrow, the World Cancer Day, Closing the Gap, we are hoping that we will be able to have equitable health care and have inclusion of health care in our universal health care cover. Thank you. Thank you for listening. That's what I had for you.